Welcome to the deep dive. Today, we're looking at something absolutely fundamental to health, something we often don't even notice until it's gone: mobility.
Yeah, movement. It sounds so simple, doesn't it?
It does. It lets us exercise, live on our own terms, and honestly, it keeps all our internal systems ticking over.
It really is the engine. So our mission today is to really get into the source material we've gathered on this. We want to explore how movement works, what happens, shockingly fast, actually, when it stops, and the intensive strategies needed to manage immobility.
Okay, so let's start with the basics. Mobility is it's body movement, plain and simple.
Right. And any activity, any exercise depends on it. It needs that complex interaction between the skeleton, muscles, and the nervous system all working together.
When those three are in sync, you move.
Exactly. And the benefits of keeping that movement going are just huge. We know regular exercise directly cuts your risk for early death, heart disease, stroke, type 2 diabetes, high blood pressure, high cholesterol.
Even depression, it's like preventative medicine in action.
It really is.
Hmm.
But the flip side is immobility. When you can't move freely, can't move independently when you want to.
And here's a really critical takeaway from all this information we looked at. The risk of complications doesn't just creep up, it skyrockets.
It does. And it's based on two key things: how immobile someone is, and crucially, just how long they stay that way. The duration is incredibly important.
Okay, let's unpack that. When we think about why someone can't move, maybe a broken leg comes to mind, a cast.
Sure, that's the obvious one.
But these sources show it's much broader. It's not just about physical injury.
No, not at all. It's fascinating how many factors are involved. You've got, developmental stage or
Yeah.
age.
Right.
The sources confirm older adults tend to be the least active group overall. But interestingly, they're often the most likely to actually join planned fitness activities, like classes.
Ah, so maybe less spontaneous stuff, like sports and more structured exercise.
Precisely. Then there are internal health and lifestyle factors. Think about poor nutrition. Obesity, for example, puts enormous strain on joints, leading to things like osteoarthritis.
Makes sense.
And chronic diseases are a huge factor. They can deplete the body's protein stores needed for muscle repair, leading to muscle wasting, fatigue. It's a vicious cycle.
Yeah, even things like bad posture, stress levels, or just personal values about exercise play a part.
They do. But here's where it gets really eye-opening for me: the environmental factors.
This is where your ability to move isn't just medical, it's tied to your surroundings, your finances.
Absolutely. It's surprisingly powerful. Think about the weather or air pollution or neighborhood conditions. Is it safe?
Right.
Our sources highlight things like high crime rates or just a lack of parks, basically forcing people indoors. That's why you get phenomena like organized mall walking.
Because their immediate environment isn't safe or suitable for getting exercise.
Exactly. They have to find these controlled indoor spaces just to move safely. And beyond that, you have personal finances, the strength of your support system.
If you need help to move and don't have it, you become immobile almost by default.
It's true. So mobility really reflects this combination of medical, financial, and environmental health.
And when that movement stops, the body starts to break down almost immediately. It's not just weak muscles, it's a system-wide crisis.
It really is.
Let's get into those systemic complications. Where should we start? Maybe the musculoskeletal system? That seems like the most direct hit.
Yeah, it's often one of the first systems affected, and the speed is, it's alarming.
How fast are we talking?
The numbers are pretty stark. Immobility can lead to about a 10% loss of muscle strength. That's actual muscle wasting, or atrophy per week.
10% per week. That's incredible.
It is. Your body basically decides it doesn't need that muscle if it's not being used, and it starts breaking it down. Plus, your joints get stiff really quickly. That can lead to contractures.
Which are permanent, right? The muscles and tendons actually shorten.
Yes, permanent shortening. So fighting against that kind of decline takes constant effort. Interventions have to be pretty relentless.
Like range of motion exercises, ROM active, where the person moves themselves.
Or passive, where someone else moves their limbs for them. And you have to support the body internally, too. That means a protein-rich diet to try and combat that muscle loss.
And getting people up, right? Assisting them to stand or walk.
Absolutely, but always, always, after doing a proper fall risk assessment, safety is paramount. You can't risk a fall.
Okay, next system. The skin, the integumentary system. The big danger here is pressure injuries or pressure ulcers.
Yeah, and the mechanism is, it's simple but harsh. Immobility means constant pressure on certain areas, which compresses the tiny blood vessels, the capillaries.
Shutting off blood flow.
Exactly. Less circulation leads to ischemia tissue damage or death, and that's your pressure injury.
So managing this sounds like it requires intense vigilance. The sources talk about turning schedules.
Oh yeah, for someone completely dependent, it's often turning them every 2 hours.
Well,
Clinically, you'll hear Q hours.
every 2 hours, run the kneeing clock.
And if they're sitting in a chair, they need to shift their weight or be repositioned every 15 minutes and limit sitting to just 1 hour at a time.
Wow, that's demanding.
It is. And it's not just turning. You need positioning devices, keeping the skin dry, making sure the bed sheets are completely smooth and dry. Even a wrinkle can cause damage over time.
A wrinkle in the sheet. Okay. Let's move to the cardiovascular system. Normally, movement helps pump blood back to the heart, right? What happens when that stops?
Well, the heart actually has to work harder just to circulate blood when you're immobile, and you get venous stasis.
Blood pooling.
Yeah, gravity causes blood to pool, especially in the legs. That leads to swelling or edema and seriously increases the risk for a DVT, deep vein thrombosis, a blood clot.
Which can be really dangerous.
Extremely. Plus, you get that dizziness when you try to stand up.
Oh, yeah, that head rush feeling.
That's orthostatic hypotension. The body kind of loses its ability to regulate blood pressure quickly when changing position. So interventions focus on pushing that pooled blood back up.
Like those compression devices, SCDs.
Exactly. Sequential compression devices, sleeves that inflate and deflate to squeeze the legs. And also anti-embolic stockings, like TED hose, which provide constant pressure. Both aim to prevent pooling and help venous return.
Okay, respiratory system next. I guess if you're not moving much, you're not breathing deeply either.
That's the core issue. Your chest wall muscles weaken, so breathing becomes shallow.
And shallow breathing isn't good for the lungs.
No. Secretions can pool in the airways because you're not coughing or breathing deeply enough to clear them. These pooled secretions can block air passages, reduce gas exchange.
Leading to things like atelectasis, lung collapse.
Partial or full lung collapse, yes. Or pneumonia. Very serious risks.
So interventions must focus on keeping the lungs clear and expanded.
Right. Positioning is key, often sitting the person up as much as possible, like in a high Fowler's position, to allow the lungs maximum room to expand. Increasing fluids helps thin secretions too.
And deep breathing exercises, maybe using that instead of spirometer device.
Definitely. That device gives visual feedback to encourage those deep, sustained breaths. And sometimes chest physical therapy, CPT, might be needed, plus frequent listening to lung sounds, maybe every couple of hours.
Got it. What about the gut, the gastrointestinal system?
It slows down too. Less movement means decreased peristalsis, those muscle contractions that move food along.
Leads to constipation.
Yes, constipation is very common. And in severe cases, you could get a paralytic ileus, where the bowel just stops working. Plus, appetite often decreases, digestion slows, so calorie intake can drop too.
Interventions, there would be things like stool softeners, fiber, fluids.
Exactly. Keeping things moving as much as possible.
And we absolutely cannot forget the psychological impact of all this.
No, it's profound. Moodiness, anxiety, depression, withdrawal. It often goes hand in hand with immobility. Sleep patterns get disrupted. The ability to do simple self-care tasks diminishes.
The physical breakdown really impacts mental well-being directly.
Absolutely. So when we look at the bigger picture, all these interventions we've discussed for skin, muscles, heart, lungs, gut, they're about managing the complications of being immobile.
But the next step, the goal, is to actually promote movement again, right? While keeping everyone safe.
That's the goal. And that brings us to things like safe handling and ergonomics. This isn't just about the patient. It's critical for the caregiver too.
What are the basics there?
Well, some key rules. Keep your own center of gravity stable. Always face the direction you're moving. Clear away any obstacles first. Simple things, but vital.
And moving patients is physically demanding work.
Incredibly, moving a client up in bed is actually cited as a major cause of back injuries for healthcare workers. That's why many places have strict policies, like no manual lift or no solo lift.
Because people aren't like neat boxes, their weight isn't evenly distributed.
But not at all. And if a client is confused or combative, the injury risk for the caregiver just skyrockets. It's a real physical challenge.
Which makes positioning people correctly so important. It's more than just making them comfortable.
Oh, much more. The main goal is maintaining good body alignment. We use tools like pillows, special hand rolls to keep hands functional, trochanter rolls by the hips to stop legs rolling outwards.
All to prevent problems like contractures or pressure points.
Right. Frequent position changes are crucial to prevent discomfort, stiffness, pressure damage, even nerve or circulation issues. We talked about specific bed positions earlier. Fowler's, supine, prone, lateral, Sims, Trendelenburg.
Instead of listing them all, maybe we focus on the why, like elevating the head with Fowler's positions helps breathing.
Exactly. Or using Trendelenburg positions, tilting the bed, might be for managing blood pressure or helping venous return. It's about using gravity and angles strategically.
Engineering the body in space,
Mm.
essentially.
That's a good way to put it. And before any move, any transfer, assessment comes first. Always.
You need to know. Can they bear any weight? Can they help at all? Are they cooperative? Do they need pain meds beforehand?
All of that. Then you pick the right tool for the job.
Like a transfer belt for assisting someone who can partially help?
Yes, or a transfer board to bridge a gap, say between bed and chair. Maybe just a transfer blanket or slide sheet to move someone up in bed with less friction.
And for those who can't assist much or at all.
That's where mechanical lifts are essential for the safety of both the patient and the staff.
Okay, and finally, helping people regain independence with assistive devices.
Right. Things like canes for a bit of support, walkers for more stability.
Crutches too, forearm ones, or the standard underarm axillary crutches.
Exactly. And there are different ways to walk with crutches, different gaits, 2-point, 3-point, 4-point, swing to, swing through, depending on how much weight the person can put on their legs.
We don't need to detail the gaits, but the point is they allow people to start moving independently again, bearing weight safely.
Which is the ultimate goal, really, restoring that critical independence.
This whole deep dive really highlights how finely balanced our bodies are. That speed of decline, 10% muscle loss a week, it just underscores why the interventions have to be so intensive.
It really does. And it shows why assessment has to be so broad, looking at everything from nutrition to, as we said, neighborhood safety, just to support that basic ability to move.
It's incredibly complex, requires such holistic thinking.
It does. And that brings up maybe a final thought, something for you, the listener, to consider. We know immobility takes a huge psychological toll: anxiety, depression, messed up sleep, loss of self-care.
Yeah.
So given how interconnected everything is, to what extent does successfully treating the physical problems like getting lungs clear of secretions or getting the gut moving again, how much does that directly help lift that psychological burden? Does fixing the body start to fix the mind in these cases?
That's a powerful question. Thinking about that connection really drives home what comprehensive whole person care actually means, something to definitely mull over. We'll see you next time for the next deep dive.